Great. Hello, officially to our November STEM Talks event. For those of you that have never been to one of our UHN STEM Pathways events before, I'll give you a brief introduction in terms of what you will expect. Basically, every month our team hosts a virtual career panel that's focused on a specific topic or a specific field, and we have 3 individuals talk about what they do in that field. So for November, we've decided to focus on digital health. So digital health is essentially kind of using information and communication technology in medicine, and you'll learn more about what that means and what type of jobs exist in the digital health field. So how the event will work today is we'll have each of our speakers first introduce themselves, talk about how they got to where they are and what they currently do at UHN. After all of them finish talking, you will have an open Q&A period where you can ask any questions that you have. So feel free to put your questions in the chat. We'll also address any pre-submitted questions at that time. You also can see that I am recording the event, so just be mindful if you are putting your camera on or turning your audio on. We don't want to disrupt the ongoing recording for those of you that also want to watch this back later. And then lastly, if you are here for a certificate of participation program, there are 2 requirements to get credit for it. First, you have to make sure your first and last name is spelled properly on the Zoom call, so just make sure you spelled it properly. And secondly, you do have to complete the exit poll at the end of the event. So the poll will just ask you a few questions of like what you learned today, ask you a few specific things. It's not too complicated, so feel free to do it. So before starting into the talk, I do want to have a welcome poll. So Trisha's going to launch a welcome poll. We just want to know who's in the call right now. If you do know things about digital health, if you are interested in digital health, just so we know when we are asking and answering questions over the course of the event. So for those of you, though, that are here for the very first time, maybe don't know what I'm referring to when I'm talking about the Certificate of Participation program. Basically, this is a program where we provide certificates for students to attend a lot of our STEM events. So if you attend 7 of our events from, I guess, September or now November until January, you'll get a certificate from UHN that's signed by senior UHN leadership. But if you are also in the SHISM Health and Wellness program, you can either get the medical terminology or lab practices certificate in addition to the regular UHN certificate. So we have a lot of events that will be eligible for the certificate program. So for instance, the STEM Talk series, we have interactive virtual events as well, and even in-person things like PA Day at UHN. So there's lots of opportunities from now until June to be able to hit those 7 events. These are some of the few events that are coming up in the next few months. So we have neuroscience, medicine, and even nursing panels with different individuals from UHN. And Trisha will also put this information in the chat so you can read more about it there. So with that in mind, I think we'll just start the panel and have our first speaker talk about their amazing career. So Vivian, whenever you are ready, take over, screen share, and talk about yourself.
Yeah, so thanks so much for having me. Hi, everyone. My name is Vivian Chu. I am currently a PhD student in the Department of Medical Biophysics at the University of Toronto. I'm also affiliated with the Princess Margaret Cancer Center and Vector Institute. And what that kind of means is that I have my supervisors or the principal investigators of the labs that I'm in are also affiliated with those institutions. And so I get to kind of be part of them as well, and do all the fun science in there as well. So just a little bit of background about me. I'm actually from Toronto, Ontario, specifically in North York, if anybody's familiar with that area. And for my undergrad, I actually moved to Waterloo, Ontario for my undergraduate studies. These are my friends, and when we graduated and we got like our Bachelor of Science, it was really fun. I did a molecular genetics specialization and bioinformatics option, and I didn't get there right off the bat. I actually entered with the biochemistry major and soon decided after I don't really like chemistry. So I moved to molecular genetics instead. And I was also really interested in computers and how we could apply computers to biology. And so I entered with the bioinformatics option. A little side quest. So a really fun thing about the University of Waterloo is that you get to do co-op if you enter their co-op program. The Faculty of Science at Waterloo does have a co-op program. And so usually it's one of the honors programs if any of you are familiar with it. But part of this co-op was my side quest in Montreal, Quebec, where I spent 8 months at the Canadian Space Agency. There's me down there holding my little poster, my supervisor, and also a really fun thing is we got to meet some astronauts. So this is Joshua Gertrick. This is I think Jenny Seide Gibbons, and there's what's his name? Sorry, you might have to. Um, there's Trudeau right there with his daughter, and I'm up here. Yeah, so it was really fun. I worked a lot with the scientists at the space agency, and it was really cool to see all the different arms and also the collaborations that they have with NASA and ESA. Um, and then after my undergrad, I actually moved back to Toronto for my PhD, and I joined the labs of Bo Wang and Hansen He, and I largely work now on cancer vaccines. So what are cancer vaccines? They're basically ideally some form of therapy that you can provide cancer patients using their DNA, RNA, and protein, and you can personalize it to help treat their cancers. So this is kind of a complicated slide, but essentially the plan is to create a end-to-end pipeline for discovering these new antigens using deep learning. And deep learning was a really big interest of mine as I moved from undergrad to my PhD, because I remember I mentioned I really wanted it to see how we can use bioinformatics and also combine it with biology. So how it kind of looks is we have a patient, we take their tumor sample, and then we can grow it as an organoid or like a kind of tumor outside of the body and perform a bunch of different like techniques in the lab to extract it, their RNA, DNA, and protein, and then use deep learning to kind of predict what specific parts of the tumor are most likely to, I don't know, contribute and wave red flags around. And yeah, so that's basically my project. And here's a little week in my life. Usually it's an amalgamation of different things. For the most part, I do participate in the lab and we attend weekly lab meetings and bi-weekly supervisory meetings. A lot of it is also research and troubleshooting with data processing and analysis. Love reading papers and staying really up to date with models, especially in deep learning. I'm also a teaching assistant for a fourth year undergrad deep learning course, and that's been really fun. And I also like to have fun through mentoring students and then helping other students troubleshoot, because as I have gained my skill set in coding and also in biology, I've been able to help my fellow lab mates see what kind of techniques or computational models might work best with their data. I also like organizing student gatherings with their graduate association. It helps build community. Yeah. So why did I choose this career? Well, I wanted a career where I could help patients, and there's a lot of different ways that you can help patients. You can do it directly or indirectly, and I chose to do it indirectly because every part of the pipeline where you do help patients, it's really important, and I thought I could do it through impactful research. And I also discovered a passion for being interdisciplinary. So a common theme is I like to combine biology and computer science, and I kind of preferred it more than being in the wet lab. And it's just a like personal preference. I'm also really excited to work in an impactful area like cancer vaccines, and staying curious is something that is keeping me young. So
Thank you, Vivian. Pedro, whenever you're ready, take over screen share.
Yeah, so hello everybody. Thank you, Vivian, for the great presentation introduction as well. Yeah, I'm Pedro Vamovitsky. I'm currently a scientific associate at the Center for Digital Therapeutics at UHN. So a little bit of background. I'm originally from Brazil, came to Canada in 2018 to pursue a PhD at the University of Waterloo as well. Have been working at the Center for Digital Therapeutics for a little over a year. Started as a postdoctoral fellow and then moved on to a scientific associate position. And I guess just, some personal things. On my free time, I really enjoy traveling, love watching movies, playing with my cat, seen here in the photo, judging me for working and not giving her enough attention. And then the picture that I have there too is actually at a conference that I went for work in Washington, but luckily I had some time to visit the Smithsonian Museum where they had the space shuttle, so that was pretty cool. In terms of education, so I did my bachelor's and master's in Brazil, bachelor's in engineering and master's in computer science. During my master's in computer science, I also had the opportunity to do an internship at something called the Apple Developer Academy. So they have these different Apple Academy sites all over the world. They are created by Apple in partnership with whatever university they are located in. And basically, they teach students about how to develop apps. So this was a very fun experience as well, and that is what kind of led me to my PhD here in Canada in public health sciences at the University of Waterloo. So I'm gonna switch the order of the slides a little bit and just talk a little bit about why I chose this career. Because as you can see, my background is very much it's a little bit all over the place. Started in engineering, went to computing, then kind of landed in health. But it kind of made sense for me. So basically, I really wanted a career that I felt motivated. Realized that for me, that meant working on something that I felt that was relevant and that can help people. I actually did a lot of trial and error until I found out what I wanted out of a career. And I mean like a lot of trial and error, work at banks, work at movie production companies, work at programming companies until I found out that I really liked research, I really liked learning new things, and I really liked this innovation aspect, but I also really liked working on projects and topics that I felt could really make a difference for people. And specifically about CDTX, the Center for Digital Therapeutics, what attracted me was getting to work with this amazing first-class team, a very collaborative environment, but also because it's located inside UHN, it's not just a matter of creating applications, creating products. We can actually put that on the hands of patients and see if that's actually co-designing that with patients and seeing if that is improving their lives. So that really attracted me as well. In terms of what I actually do at the center, so basically my work focuses on exploring the use of novel technologies, mainly artificial intelligence, to understand how we can improve chronic disease management and patient care. And so, like I said, in the center, basically we do digital health applications, digital therapeutics, but there is this kind of pipeline from creating the product to actually implementing it inside the UHN hospitals. And a really cool thing that I love about where I work is that these products are not considered, say, an app on the App Store alone. They are actually considered medical grade research devices according to Health Canada. So they're actually regulated. We have a whole team to ensure quality and maintenance. So that's something that I love because I feel that it's not just a matter of, creating these things, but actually putting them to work to help people. So the two main projects that I'm working on, one of them is called Keeping in Touch project. So that involves a large language model. Actually, I have a question. Maybe you guys can just raise your hand. Like, how many of you here are well, obviously, I think everybody's familiar with ChatGPT, but like, how many of you use it like in your daily lives? Like, if you maybe have a healthcare question. Um, okay, I see like a lot of hands. Yeah, that's kind of what I imagined. Um, so yeah, basically me too. Like I use ChatGPT all the time. But the problem is like if you're talking about healthcare, right? This is a very, very risky field. And you probably know that ChatGPT has a lot of not just ChatGPT, but Claude, like all of these large language models, they have a lot of dangers. Sometimes they can create inaccurate or incorrect answers. They can like invent something, they can hallucinate. So the question is, how can we make sure that we are creating something that is safe, that is kind of taking advantage of these amazing technologies, but it also safe for people to use? So kids specifically, we focus on youth with type 1 diabetes. So people at a life stage similar to yourselves, maybe transitioning from pediatric to adult care. So kind of leaving high school, going to university. So in addition to just having to go through all these lifestyle changes, you also need to take care of your type 1 diabetes if you have it. So there's a lot of challenges there. And so what we tried doing is exploring how we can use ChatGPT to help people with like the sort of Q&A feature for type 1 diabetes, but while ensuring safety. So this is the prototype that we have. So this is just a live demo of what we have. So Basically, the idea is that people can ask questions about diabetes. In this case, for example, how do I guess carbs when there's no labels, like at college meals? So it's gonna give you like an answer. But what we basically did is that we gave it a lot of like evidence-based documents validated by clinicians and told it to only use those documents. Seems simple, but it's actually more complicated than it is because we kind of have to like really validate those documents. We have to convert them to this kind of numerical vector. We have to make sure through prompt engineering that it understands what it has to do. Then it kind of creates the answer. And at the end of it, you see that it's providing, I don't know if you can see it because there's the video loading, but yeah, there you go. So you can see that there's the links in the bottom there where you can kind of see that basically where we got this information from. So this is kind of the way that we found so far to kind of reduce some of those risks. We also kind of played around with it. So we, in this case, we gave it this kind of like Gen Z persona. So it, uses emojis, uses a lot of slangs, just something that we thought would maybe be a little bit more fun. And this is actually already implemented on an ongoing trial, so on an ongoing study. So we're kind of evaluating it to see if we got it right. So that's kind of one of the main projects that I'm working on. Let me just I'll just share my screen again with the presentation. So yeah, so this is so KID is one of the main projects, and then the other one we call FORT. So that's focusing on predicting student mental health. So this one doesn't really look too much into large language models, but in more traditional AI. So like what Vivian was saying, like machine learning and deep learning. So basically, we actually have a data set of 4 years of student mental health data from a major Canadian university. As far as we know, this is the only data set of its kind that exists in Canada, at least in Ontario. So basically what we're trying to do is, okay, so we have all of this data and this data is being collected basically every fall and spring terms. So can we maybe based on data from the fall, say, predict somebody's going to have worsening depression or anxiety in the spring? And so what the figure here on the left side actually shows is the actual factors that may be affecting that prediction. So in this case, for example, the first variable here means if somebody has a history of anxiety. Stress 3 means basically an item of a questionnaire. I believe it's if things are spinning out of control. F anxiety means a family history of anxiety. So we can kind of not only try to predict this, but also see which factors are really contributing to that risk. History of bullying is another one, for example. And so based on that, we kind of hope to give people recommendations on how to handle their mental health. So for example, if they are really at risk, then we can maybe send them some resources. In this case, like if they have a history of anxiety, maybe some resources on how to deal with that. If they're really like if there's something really worrisome there, we can recommend them to counseling or maybe do some more urgent care options. So that's kind of what the fourth project's all about. And then just in terms of a week in the life, one of the things that I love about the center, in addition to what I already mentioned, is that it's a very flexible workspace. So it has actually great accommodations, great work-life balance. So that actually allows me to work from home 3 days a week. Like today, I'm not in the office, as you can see. So it's pretty great. They also have flexible working hours. So usually 9 to 5, but I can kind of choose my working hours. So I personally really like that. I typically divide my time between these two projects. So whether it's the large language model one or the mental health prediction one, typically this involves developing the prototypes, like the demo I showed, kind of testing and running those prototypes, analyze the results, and then based on the results, see what I have to do. I like to say that I basically assess, I try to improve, and then repeat, test, see what works, what doesn't work, and so on and so forth. It also involves a lot of administrative tasks, lots of writing. This could be writing papers for publication. This could be writing grants, basically to seek funding for this project. So that's something that I wasn't aware of until I started getting into the more research career, but a lot of it involves applying for grants for like different agencies, different universities, to see if we can get actually money to do this research, because we do have to pay, my salary, the salary of my teammates. And then also a lot of research, there's reading academic papers, getting familiar with the latest technology trends, which I personally love. I think what Vivian said about, this multidisciplinary aspect, I love kind of like delving into a new research topic or a new area. We are now thinking about projects in large language models for not only in diabetes, but also for mental health, heart failure, things like that. So I do love researching that. So yeah, hopefully that's gives you a decent idea of what I do. Feel free also to connect with me on LinkedIn. Always happy to chat more. And now I'll pass on to Lindsay.
Thank you, Pedro. Lots of cool things you're doing. Let's see what Lindsay's doing now.
Okay, perfect. So hi, I'm Lindsay. I am a PhD candidate at the Institute of Biomedical Engineering at the University of Toronto. Similar to Vivian, I'm also associated with UHN, specifically the Toronto Rehabilitation Institute, which also means that my supervisors are based there, and so I got to use a lot of the cool labs and facilities at the Institute. So just a bit of background about me. I am born and raised in Toronto, and I have lived here for almost my whole life. Or I should clarify, GTA, not Toronto proper. I'm currently pursuing my PhD, like I mentioned, and have been for the past 3 years. And then on my spare time, I enjoy traveling, reading, and painting. And I actually just started learning tennis last summer. So not that great at it yet, but definitely improving my skills. So regarding my education background, I attended Queen's University, which is based in Kingston, so about 3.5 hours out of Toronto, in between Montreal and Toronto. And I got my bachelor's of applied science there, specializing in mechanical engineering. So the way it worked at Queen's, at least when I attended, is that first year engineering was general, and then second year, you were able to specialize more specifically into your discipline, so mechanical, electrical, computer, whatever you would like to choose. And then as you progressed, you got to move forward further and further into your specialization. So I chose to specialize in biomechanics in my third and fourth year. And so that kind of sparked my interest to pursue a PhD at the University of Toronto, specializing in biomedical engineering specifically. So that leads me to my research project, which is about wound care and prevention. So my research overall focuses on preventing injuries to the skin and underlying tissues while people are lying in bed using various sensors and predictive algorithms. So more specifically, there are kind of two phases to my research. One is to detect which positions individuals are lying in and for how long. And this typically uses deep learning image classifiers, either 2D or 3D classifiers. And so here you can see just a little image of different pressure distribution frames that were captured using a pressure sensor sheet on different mattresses with people lying in different positions. And so you can see that certain regions have higher intensity pressures, such as in orange and red, compared to other lower pressure regions, such as in blue. The second part of my research is looking at wound prediction, so predicting the development of these types of wounds based off of health record data, demographic data, and environmental conditions. So where they're lying, the conditions they're lying in. And this typically uses more machine learning based algorithms rather than more deep learning algorithms, just because it's more efficient and kind of all we really need to do these types of predictions. So typically a week in my life focuses on a variety of different tasks. We have bi-weekly lab meetings, which basically means that every other week we sit at a table with the entire lab and my supervisors, and we just discuss the different progresses and events that we've had within the past 2 weeks. And then we get to collaborate, share ideas, and help each other out if any of us are running into problems. I also have weekly supervisory meetings, so I meet with my supervisor one-on-one so that I can get help, progress, and move forward throughout my thesis. Depending on the week, I either am in my data collection phase, so collecting data on human participants, or cleaning this data or analyzing the data. So right now I'm in my sort of analysis and cleaning phase. In addition to my research activities, I also TA. One of my favorite courses that I have ever experienced TAing is a first year engineering design course, just because we get to see students applying the classic math, physics, biology, whatever type of courses you're taking, and actually apply it to real world problems and work with real clients. And then in addition to all of that, I also do some mentorship. Specifically, a master's student just joined my lab, and I've been helping mentor her to get her started and ready to progress throughout her research. So why I chose this career. So overall, I feel like this has been a common theme. I'm quite interested in helping people. Specifically, I'm interested in helping people age or manage their medical conditions within their own homes or within their own spaces, so they don't have to go to and move to another facility that they may not be as comfortable with to manage these types of conditions. And so the reason why I chose to focus in research is for a variety of reasons. I have quite a curious personality, and I find that research lends a great hand to that. I get to have the option to kind of explore different avenues, do a lot of investigation into things that maybe have not been thought of before, or that have been thought of but have not really been explored. I also get to help improve people's lives. So one of the great things about my lab that I really do enjoy is that it is very heavily focused on patients. And so I've been able to collaborate with a lot of patients and caregivers to kind of help improve their daily lives. And lastly, it's quite a collaborative environment. So I get to work similarly with what was said before with a multidisciplinary team, people focused more in health or engineering or nurses and all those types of people. So it makes my research and life a little more interesting.
Thank you, Lindsay. Really exciting to hear about what you are currently doing in your PhD. So that officially ends up wrapping up our talk portion of the event. We are now going to move on to the open Q&A. So start off with a slightly more simple question. The students have now listened to all of your talks, and all of you have very different focuses in digital health. I guess the question was, how did you choose which kind of branch of digital health to get into? So why even pick something related to digital health? And then how did you decide on working in each of your specific fields and focuses? And maybe we'll go in order of speakers. So Vivian, lead us off. Why?
Sure. I think maybe Pedro and Lindsay will also follow a similar path, or maybe like a similar theme where prior to entering undergrad, I wasn't sure what I wanted to do later on, but I knew that I was good at biology. So I studied biology. And then I was like, what kinds of careers can I pursue with this biology degree? And I didn't necessarily want to work in a lab per se. So like I mentioned before, I taught myself how to code while I was in my degree and learned how to do it on my co-ops. And I just really enjoyed it. And so now with this new skill set of coding and biology, how can I combine that later on? I was also, while I was in undergrad and also in high school, I also volunteered at a hospital. And I was really exposed to being around patients and hearing about their own stories, in particular in cancer patients. And so that's why I chose to work in the cancer field using deep learning. So it's just, even though they might be different forks of my pathway, they all converged eventually. And so that's why I chose to work in that subfield of digital health.
Pedro, you want to go?
It's funny. I was thinking, so my boss, the director of the center, she loves saying that no one that works in digital health has a straight line. Everybody kind of has a circuitous path, and I'm kind of getting that feeling here. For me it was like I said, a lot of trial and error. Like I did engineering. In Brazil we have a little bit different things than in Canada. We don't really have a co-op term. We just can do internships whenever we want. Advantage of that is that I could try out a lot of different things. Disadvantage of that is that I had left for university at 7 a.m., worked my internship in the middle, went back to university later, so that wasn't great. But I discovered that I liked programming specifically. But I had learned a little bit of it during engineering, but not a lot. So I figured that if I wanted to pursue a career in that, I should probably study that more. So I did the master's in computer science. And then parallel to that, I joined that Apple Developer Academy that I mentioned. And there specifically, they basically told us to, they passed us exercises. And some of the exercises were develop this app for healthcare. I ended up really liking that and doing my master's research in healthcare. And then eventually I decided to pursue a PhD in the area. So it was a little bit circuitous, but I eventually got there.
Lindsay, what about you?
Yeah, kind of already said, but basically going into undergrad or applying to universities from high school, I didn't really know what I wanted to do. I actually applied to health and engineering programs because I really liked both biology and physics, specifically physics, because it kind of made life make a little more sense. It explained why things were happening. So I decided to pursue a degree in engineering, because of the physics aspect, and then I could touch on biology afterwards. So as I got deeper into my undergrad degree, I kind of started to specialize more and more into the bio side of engineering. And I got exposed to a variety of different things. So in my third and fourth year of undergrad, I got exposed to coding, specifically looking at how the body functions, and kind of coding that up to understand joint relations and things like that. And then after that, my final project in my undergrad, we actually looked at improving upon a prosthetic foot, primarily used in developing countries. So that really pushed me to focus into like the bio side of engineering. And through that and developing my coding skills through the different projects I learned, I decided to kind of hone in digital health. Aside from academics, I also have a lot of just experience with the aging community. I did a lot of volunteer work in long-term care facilities, and I also am really close to my grandparents who are in their mid-90s by now. And so one of the common struggles a lot of people face when aging is leaving their homes, going to a long-term care facility because they don't want to leave a space that they're comfortable in. So that kind of focused me into aging work. And then lastly, wound prevention. That just is a common effect of aging and or other comorbidities, but primarily aging. And so helping people prevent these wounds and living a better quality of life is kind of where I ended up in the end.
Basically, they don't have to decide what they want right now. You can accidentally end up in it later. So we have a lot of questions about coding, which I guess makes sense, digital coding. So the first question I have is, does coding actually help you in STEM careers? I think the answer is yes. But like, how important is it in your current job? Do I need to know how to code now? Can I teach myself how to code? Kind of just a general interest. Maybe Vivian, do you have any, tips and tricks for coding?
Yeah, sure. There's a lot of resources if you're interested in learning how to code, like Codecademy, or there's also like the Google Development like course. That's online as well, along with like other online courses like Coursera or Udemy. And that's kind of how I got my footing in coding. In terms of how valuable it is in STEM careers, I think it depends on what STEM career you're looking at. For example, not all STEM careers are coding. Some are actually like in the lab. Some, I don't know, deal directly with like formulas or something like that. But at least for what I do in my PhD, I work with a lot of data. And so that's why with this really big amount of data, you have to analyze it really fast and also really accurately. And so I use tools like Python, R, etc., to do these types of models and analyses and like build visualizations and whatnot. It's also really helpful for repetitive tasks. But otherwise, you don't necessarily need it. I think you should pursue learning it if you are genuinely interested in learning how to code, and if your job in the future that you're interested in entails coding. It definitely did help me in the end, but I wouldn't say it's like absolutely needed.
All right, good. They don't have to be scared of that. Pedro, I guess other questions are, is there a specific kind of coding or programming language that's commonly used in medical research? So if they are interested, they should focus on learning that, or
Yeah, I mean, that really depends on what you want to do. Because I deal with artificial intelligence, usually people use Python. So if that's something that you specifically want to do, I recommend Python. And also for data analysis as well. A lot of people, like Vivian said, use R, especially if you're doing more statistics. In general, though, it really depends on what you want to do. Like if you want to do apps, that's another language altogether. The thing though is that most languages, R is actually a little bit different, but like most languages, they follow the same programming logic. So I would say like if you're interested in coding, get one language. Don't care too much about which one. Maybe Python because more popular, but like don't I wouldn't care too much about which one because I feel that like once you learn the basic logic of how a language works, it's very easy for you to then learn another language. Like at least that was the case for me. Yeah, hopefully that helps.
I think, Lindsay, anything you want to add on that? Or I can ask you a specific question that came for you.
I think I agree with everything Pedro said. I like want to echo. I feel like coding can be a very scary task to start with. But once you practice a lot and kind of apply it in your day-to-day tasks, it becomes a lot easier. It's like writing, it just becomes easier the more you practice. But Python is a good language to start just because it is very widely used. So there's a lot of resources out there to start learning it. And also, I believe Harvard or MIT offer like free online classes as well. So if you don't have to like spend money to learn how to code.
All right, that is good to know. All right, question for you, Lindsay, about U of T. What is U of T like, and why did you pick U of T for your engineering degree?
Yeah, so U of T is quite a big campus, and there's three of them, I think. So very, very different or dependent on where you're at. I'm at the St. George campus, which is downtown. And it's like a very nice campus. The buildings, I like architecture a little, so the buildings, most of them are like quite old, so you get to see kind of like the historical influence of the campus, and it's also situated in Toronto, so you just have access to so many things around. I can only speak for engineering, especially for the graduate, but I TA undergrad, so I can kind of speak for them too. But engineering specifically, I find is like a pretty good community. You get a lot of support from your peers going through kind of the same experience, and will often help each other out. So U of T is fun. Good to go to, good education, specifically for grad school, which I'm sure most of you aren't even thinking about yet. They have a lot of good research facilities, and because they're affiliated with a lot of hospitals around the Toronto area, you have access to a lot of good labs in the space, which is why I decided to pursue my graduate degree there.
Vivian, you also are U of T, right? How do you feel about U of T? How did you choose U of T?
Yeah, so I did my undergrad at U Waterloo, but then I decided to go to U of T for graduate school. And I didn't choose U of T just because it's U of T. I think I more so chose it because my supervisors were people who I wanted to be mentored by. And so the thing with U of T is that a lot of professors are actually affiliated with the University Health Network. And it's what's something unique about my program, which is medical biophysics, is that a lot of the professors in this program are affiliated with a lot of different institutions. So that includes the Toronto General Hospital, Princess Margaret, Toronto Western. I think Lindsay is affiliated with rehab, right? So that's something that's really cutting edge about at least the program or the programs that we're part of at U of T. And so just being a part of that, we have access to a lot of really great facilities and actually access patient data directly because we work with doctors. And so yeah, I think like having that kind of clinical exposure and being situated centrally in Toronto, surrounded by so many hospitals, it allows you to network and also develop a lot of professional development skills. And yeah, so that's kind of why I chose U of T and my program in particular.
I guess the question related to that is, do you interact with patients? What is that like? Do any of you interact with patients or on that end of the spectrum?
I can go, I guess. I don't interact with patients actually, but that's because patient data is highly private. And we just want to be able to separate the two. I just get the data that's like anonymized on my end, and I don't have to interact with patients. But if you do have like a more clinical research role, sometimes you might be actually collecting that data yourself. But for at least my purposes, I don't.
I was just going to say, I do have the opportunity to interact both with patients and healthcare workers, which is something really cool. So because my research is so focused on like what is happening to the patient themselves. I've had the opportunity to speak to a lot of patients and hear their experiences with the health system, with long-term care facilities, to try and like help guide my project so that what I do actually helps them, and not just like an idea I came up with that I have no context to. So patients often are very nice, especially if they want to participate in your study. They're often like willing to collaborate and want the help that you're trying to provide.
Yeah, I haven't yet. I actually will. Like one of the things that we're gonna do once we have some of these prototypes ready is sit down with patients and show them what we have and let them tell us what work and what doesn't. So yeah, I think that just getting that feedback. I heard from other people that interacted with them, they had very similar experiences to Lindsay, I guess. They're usually very helpful and very willing to like if they think this is something that can help them and other patients in the future, they're very much willing to learn. But in general, what I see more is like I don't interact directly with patients, but I do get patient data. So long as we have like all the necessary permissions, and usually it's data like I cannot identify which patient I'm, analyzing the data from, but usually we use patient data to kind of do our research.
Perfect. So you can do either of them if you're interested. All right, we have a question, I guess, kind of for all of you. How do healthcare technologies improve patient outcomes compared to traditional methods that exist out there? Better, worse, equal? Pedro, you want to attempt this? Healthcare technology.
Sure. So that's a very broad question, and I can pick and choose any example to make whatever argument I want. So like, yeah, I'll give you an example. So ChatGPT, LLMs, all that stuff. There was a report last week that some hospital was using this transcription service to like summarize doctor notes, and I guess it was making something up. So in that case, clearly it's worse than traditional methods. I think it's all a matter of like I don't think that this is like I don't think it's a binary yes or no answer. I think like it's not the technology itself. Technology itself is a tool. What you really have to watch out for is designing some kind of care model that takes the technology into account. So for example, if you know that like what we're doing, like if I know that this ChatGPT has these problems, how can I make sure that whatever I'm using ChatGPT for is as safe as can be? As an example, right? So I think that's I think it's more important to design how you're going to implement the technology in practice. The technology itself is just a tool that you use.
Anyone else want to answer?
I guess I can give some more examples of how AI is being implemented in healthcare, just off the top of my head. An example is like in diagnostic imaging. So some of you guys might have heard of like MRIs or X-rays, and these images typically rely on like radiologists, which are doctors, to manually review those images. And if you have a ton of those, then it's really time consuming, and sometimes the doctors might be tired. So there has been like AI models that have been trained to kind of segment or identify a specific type of case in these images, and that really helps up speed time for screening through these images. Something that I'm working on is like personalized treatment plans. So remember I mentioned like cancer vaccines. There's a couple of startups right now that are working on analyzing like genetic mutations in DNA and whatnot, and trying to design drugs to specifically target those genetic variations. There's so many more, but I think, yeah, just to echo Pedro, it's not like AI is replacing healthcare doctors. It's a tool, and we should use that tool very wisely.
Maybe I can ask you the next question, Lindsay. The students are asking, so you were working on different tools and technologies. How long until these are actually on the market and actually being used by the general public in the general healthcare field?
Yeah, so I can't give you an exact time frame, but specifically like with medical-based devices, there's a lot of protocols to kind of ensure efficacy and safety before these like medical technologies are being implemented. So for the first stage of my research, I was looking at using healthy participants to kind of create, generate, and test these models that I've been developing. For the second phase of my research, I'm now able, pending ethical approval, to use these on consenting patients. Depending on the outcomes, it will depend on how we can proceed moving forward. But hopefully they're good outcomes, but further testing is required and typically on quite large sample sizes, so like hundreds and hundreds of patients before you can move forward to kind of look at getting like Health Canada approval. So before medical devices can be implemented in places like hospitals and used by clinicians, they have to be approved by a body of people to ensure that these medical devices are safe. So you have to then seek for approval and go through this whole process. And then depending on how that works, if you get approval, then you can start using them in real life. But it typically is a process to happen, yeah.
That was a nice little summary. Anyone want to add anything on how quick their stuff is going to get to market?
I would say maybe like yeah, it's hard to give an exact estimate. In my experience, if you're like going from creating a prototype to testing it out to the users to having something ready, it's probably gonna be like maybe a couple of years, 2, 3 years, and then you still have to go and get those Health Canada approvals. So I guess just to kind of like it's a bit different. Like say that you as you know yourself are like putting an app on the App Store. You can do that very easily. You just have to like create the app and its approval is like a week. You just have to pay $100 to have like the Apple developer thing that allows you to put an app in the App Store. That's a little bit different, I guess, than what I'm doing. I'm talking specifically about software. I know that other people work with like more, biological stuff. But like specifically about software, it's a little bit different when you actually want this to be like a medical device that is used by patients. So it's not. So if you're just talking about yourself and putting something on the App Store, super easy, so long as you respect their guidelines and just don't do anything too crazy. If you're talking about anything more complicated, I would say probably 2 to 3 years you see there to have something tested, and then you still have to apply for regulatory approval.
What about you, Vivian?
Lindsay and Pedro kind of covered it for the most part. Something that might be interesting because this is like a UHN talk. The UHN actually has an AI hub, which I'm part of, and also my lab is part of. But the AI hub actually tries to help with clinical implementation of these AI tools. We have a lot of collaborations with nurses and doctors and patients themselves. And a lot of the things that we do discuss is related to like data privacy, algorithmic bias, patient safety protocols and whatnot. So those are like the regulations that Petro is referring to. But yeah, for the most part, you did cover most of it.
All right, let's see. I have a pre-submitted question. A student is asking, what is your kind of favorite or the best part of your job and the worst part of your job? So we want the highs and the lows. And let's go in reverse order. Lindsay, highs and lows.
I would say one of my favorite parts about my job is just like interacting with participants. So I'm very fortunate to be able to collect my own data. And so I've had the opportunity to interact with people who may use the devices that I'm hoping to create. The less fun part about my job is there's a lot of writing that goes along with research. You have to submit ethical approvals, you have to write grants, you have to submit papers for publishing, go to conferences. There's a lot of writing, which to me is not the most fun thing, but it helps share my research and help collaborate with others. So there is some good to it, I guess.
Right, just writing, no big deal. Pedro, what about you?
Yeah, it's the favorite part. It's kind of hard because there's so much I like, and I don't mean to be that guy because I feel that everybody's super fake when they say I love my job all the time. Like, yeah, you're no, you don't. But I do love a lot of it. I think my favorite thing is just like working in research and working with these technologies. I get to have my hand in a lot of different pies, like a lot of different projects, a lot of different topics. Get to experiment with all of these new technologies. So I really like that, and it's really experimenting. Like, it's not I'm not particularly trying to deliver like a product here. I'm just trying to see if this works, which I really like. So like there's opportunity for failure and learning there. Um, in terms of this, like, yeah, I would echo Lindsay, not so much the writing part. I personally like writing, but there's a lot of bureaucracy, like, yeah, ethics applications, all of that, waiting for data. That can be a hassle. Like, I've been waiting for a few months now to get some data, and I can't do my work without it, for example. So that can definitely be a hassle. And I guess I'll just add too, since you guys are students entering the workplace, a job is a job. So like you can love in theory what you do. There's gonna be days that you don't really want to go to work. That's completely normal. At least for me, what's important, I guess, is that you like the big picture of it and you keep motivated with the big picture.
Vivian, what about you?
I really like troubleshooting, even though like I feel like that's a lot of people's worst. But I really like troubleshooting because it really hones in on the problem solving part of my brain. And you can approach problems really logically using code. Um, the worst part, I don't think it's the worst part, but I feel like it's also problem solving because a lot of medical data is often really messy or incomplete or like inconsistent. And so it's like pretty time consuming to work with the data itself. So I guess like it's bittersweet. It's not uncommon to spend lots of late nights in the lab, but yeah.
Right, so there's good and bad. That's like a normal job. So we only have a few minutes left of the event. So I'm going to ask you one last question, but as I'm asking you the question, Trisha, can you launch the exit poll? So remember, this is the poll that you will need to complete if you want to count for the certificate program. Hopefully the questions aren't too hard, but like we're just asking you, for instance, if you learned what deep learning means over the course of this hour. So I guess the last question I have for all of you is, so all of these students are often like in high school, maybe they're starting off undergrad. Do you have a piece of advice for them as they continue their education and they explore what career pathway to pursue? And I guess we'll go in order of speakers. Vivian, what's your piece of advice for the students?
Um, Something that I've learned over the years is to be your own champion, and I think that really applies to a lot of different things other than grad school. I see a lot of the time that people end up counting themselves out of opportunities because they feel like they don't have the skill set or they're not good enough, and you can only count yourself out of the race before even entering the race, right? So really like be your own cheerleader, be your own champion, apply to everything. You might just get it's all sometimes a numbers game. And yeah, that's what I would leave you guys.
A nice short and sweet one. Pedro, what about you?
Yeah, I would completely agree with that. In fact, looking for jobs and opportunities is like super disheartening. Yeah, it's very important to keep motivated. I'd also add like, I think you guys are a little bit too young for this, but like, once I started working, I really started thinking about what motivated me in terms of like what I wanted out of a career. So, for example, when I was working in banking, I knew that I could probably continue working there and probably make way more money than I'm making now, but I also thought I would be more unhappy. It's completely okay though if you do want to make money. Like, I have a lot of like my sister works in banks. She loves. I don't think she likes her job per se. I do think she likes the money that she makes. But it's completely okay that she's motivated by this. So, in my case, like I said, I'm more motivated about like I like doing something that I feel it's a little bit maybe more relevant that people are going to use. So I really think it's important to maybe start just thinking about not so much the practical, like what would I like to do on my day to day and these tasks, but maybe just what really you think is going to motivate you like internally. And I think based on that, you can start kind of building your career plans around that.
All right, and Lindsay, what about you?
I guess the biggest thing I've learned, and still trying to improve upon is like not being afraid of failing. I found that going from high school where I got really great marks, didn't have to study that much. Going to university was a whole different ballgame. A lot more pressure, a lot more work. And sometimes you don't do as well as you did in high school, at least at the beginning while you're trying to adjust. And that's like completely okay. And most people go through that experience. So just keep like pushing through, trying your hardest, especially if it's something you're passionate and interested about, it'll end up working out in the end.
That's a nice little endpoint. So I'm just gonna do 2 wrap-up slides. Hopefully everyone is filling out the poll and getting the answers correct. We'll find out afterwards. Let's see. Last slides. All right, hopefully it is full screen. All right, so thank you officially for attending our November STEM talk. So we do hope that you've learned something. I think we asked that in the exit poll. But if you do want to learn more about other careers in healthcare, or even just come visit us in person for some of our programming, you can check out our website to learn more, www.UHNSTEMPathways.ca. Or you can always contact us on various social media. If you have questions about the certificate program, probably best to just directly email us and we will try to answer all of those at that time.